way initially, but here she is right here. And of course, Geoff Beecher below. And thank you both so much for being with me today. Thanks for joining me on the show.
Hi, Claire.
It's a pleasure. Thanks.
Hi, Gail.
Hey, Geoff.
So it's pretty cool when worlds collide on this show. We don't often have the chance to do a panel like this, but Dr. Lebovic and I were talking a couple of months ago on a previous recording, and we started talking about job fulfillment. And what's unique about these folks that I have here today, for those of you who don't know Dr. Gail Lebovic, she's a visionary inventor, a medtech entrepreneur. Also, she has been behind some of the most incredible products, including one called Nasa Cleanse, which she's still working on right now. There have been some really interesting pivots there. But of course, she was also a surgeon. So a lot of different areas of the business where she has developed some really incredible perspectives. So we're going to jump into that today. And then also Geoff, who's a chief commercial officer over at Fraxis and a veteran medical sales device professional who's definitely seen his share of war stories and interesting situations and patient stories and heartwarming stories and everything in between. So we thought, why not come together and talk about the things that really drew all of us to this medical profession in one aspect or another, from provider to professional to being in the industry, and then now, of course, helping people brand themselves for their career in this industry. So to kick us off, I would like to start with you, Dr. Lebovic. So can you tell us a little bit about when you first knew that healthcare was your passion and that was where you wanted to make your mark? That's where you're going to stay. And how did that all come about for you?
Pretty wild. I mean, it goes back a long way, and it goes back to my initial experience as a patient myself. So when I was very young, I was a gymnast, and I had an injury when I was about 14 that required surgery. And of course, I fell in love with my surgeon, who was like Dr. Kildare. And I was just so awestruck, honestly, by what he did and how he did it. And it was just so amazing. And that was the earliest I can think of where that kernel, the seed was planted. Ooh, maybe I could be a doctor. And I was the first person in my family to ever go to college. So it was kind of a stretch. And my parents were just hoping, I'd grow up and be a mom and have a couple of kids. But anyway, that was the earliest thing that touched me, and it just keeps getting stronger and stronger, to be honest. I did have a very shocking experience as a medical student. When I saw my first mastectomy, I think I was a second-year medical student. It was horrifying, to be honest. And that was the next kind of level of, if I can do anything personally myself to change this and make it better, that's worth doing in my lifetime. So that put me on this next path that has been long. It's been arduous. It's been fabulous. It's been exciting and crazy. And I met Geoff during that time. So
yes. And how did you two come together? How did you two meet in business?
I think I'll take this one just because I remember, I had started my career in the Fortune 50, with J&J, and I'd been through that. And then I turned my attention to startups, and I'd been through maybe 3 or 4. They were, had successful exits to them. And I remember getting a call from a guy who was at a company called Focal Therapeutics, and he was telling me, basically what the product was all about. And I wasn't quite understanding what he was telling me. And so I dove into it further, and I found out what the product was actually going to do for patients. And I couldn't get to the FedEx office fast enough with my documents. I just couldn't sign on. And it was a Gail Lebovic company. It was Focal Therapeutics, and the company's BioZorb. And it's still out there. It's still being used today, or it's being marketed by Hologic, and it's a wonderful device. It's changing people's lives, helping not only focus radiation, but we're getting better cosmetic outcomes because of that device. And it's, like I said, when it was first explained to me, it wasn't explained to me properly. But when I dove into it myself and learned what exactly that it did, it fit into my background perfectly. And I did have the documents. And like I said, I was like, I remember driving to FedEx, like, get these documents off to them now. And I didn't want to miss this opportunity. And I didn't.
Mm-hmm. And
And you did a great job.
Oh, that's awesome. Yeah. Jeff, so did you know, I mean, I don't know if anybody grows up and thinks, hey, I'm going to be in medical sales, right? Maybe, maybe. Yeah. But, you know, when did you sort of go from, this is a really interesting place, like this is a really interesting industry to be in, to, oh, this is a calling. Like this is something that is really important and I'm hooked on it.
Yeah, I think I wanted to be a doctor. You know, I think deep down inside, I wanted to be a surgeon. You know, I loved biology and I loved the anatomy, and I got exposed to cadavers when I was in undergrad. So you don't usually get that, but where I went to school, we were introduced to that. The problem became back in the day, you know, organic chemistry was was that make or break, you know, and it blew me out of the water. You know, it just flat out. If you don't get it on day one, it's over. And I happened to be looking at Molly that day. You know, she was in my class and I was paying more attention to her than what was going on. So it was over, you know.
I hope Molly is your wife.
Kathy's my wife. Molly was
I was gonna say, Molly was a girlfriend at the time.
That's right.
Yeah. And so so you're like, okay, Dr. Track is not going to work out for me.
Right.
I'm still though thinking, where does healthcare play a role in my life? So focal therapeutics comes along and you think, was it immediately like, oh yes, like I definitely want to do this? Or were you thinking about pursuing other kinds of sales as well?
Well, so no, I think focal care came along long into my career. So I can remember playing golf with a buddy of mine who worked for Philips Imaging, and, you know, big, tall, handsome guy, former, you know, NFL player. We were playing, he pulled up in his Mercedes, and, you know, I think I was in my Pinto or something, you know, and he was just, you know, and he just, you know, we just talked, you know, and I don't think it was really all about money for me, but he was just saying, you know, this, with your degree, your background, just the way you are, I think you should start pursuing a career in medical. And I did. It was a long time ago, and to break in back then was just as difficult as it is now. I think maybe more so because there weren't as many companies, you know. There weren't, I mean, you turn around everywhere, there's a startup somewhere. So back then that wasn't going on, and there weren't accelerators going on. It was just me against, you know, me and the fax machine. I didn't have you helping me write a resume. Yeah, I didn't, you know. So it was just, you know, interviewing and just staying at it. I wanted it. I wanted it bad. I knew this is where I should be. And after, I don't know how long it took me, but I finally broke in. Gail, do you remember a company called Davis and Gack Sutures?
Oh, of course.
That was my break. That was my break.
Oh, that's awesome. But you know, you said something just in your introduction that I think hit the nail on the head. You said when you looked at what the product could do for patients, that's what drove you, you know, to get your paperwork together and get to the FedEx office. Yep. And I think that really separates the wheat from the chaff in medical sales. It's like, look, in sales, you're going to have people who are simply salespeople. They usually are not the pride and joy of medical device sales. Those are not the people who really succeed. They struggle. The people who succeed are in it for the patients, and they understand how the technology is going to change the patient's outcome, the patient's lives, you know, whether it's making something more comfortable, whether it's having a dynamically different outcome. And I really think that is it. That's what makes the great reps great.
When you, Dr. Gail, when you were looking at, you know, I'm sure when you were working as a surgeon that you had multitude of reps coming into your office and into the OR. Was there something that was telling about those professionals who you knew were really in it for the patients? They were really in it to be your partner in care, and those who might have just been more transactional in nature?
Oh, totally. Totally. And, you know, I have to apologize to all the reps out there right now that I literally had a brick wall. And one of those reps, actually, Sarah Lascola, turned out to be one of my very best friends, lifelong friend, because I just said, no, no, no. And then one day she managed to break through, and she turned out to be just a wonderful person. And she's a great rep. And she fits that category, just like Jeff, of people who are really in it for the right reason. You know, they really care about changing medicine, being on the cutting edge too, because startups aren't for everyone. There are a lot of people who just need to be in a big corporation, you know, and just hit the road every day and have that structure around them. Whereas in the startup environment, you have to be self-motivated, you have to be disciplined, you have to have focus and be very, very driven. And I think what I like to say is, you know, I personally am driven that way. I'm not in this for money. I never was. I don't, you know, I just don't do things for money. That's not my driver. I do it for what I call psychic income. And like Jeff, when you were talking about Biosorb and all the benefits it has for patients, I just get this incredible energy, this feeling that just makes me want to do more and more of that same thing. So I think those are the people, and you can recognize it, you feel it, and they come in the inner circle.
Yeah, I mean, I think if you, you know, you learn early on, maybe I always knew that if you just take care of the patient, everything takes care of itself, you know, so you don't have to worry about the financial, you know, it just takes care of itself. And I don't know, I've been fortunate that I got some great training from Johnson & Johnson early on. And then when I turned my attention to introducing new technologies, then I knew I was home. You know, I knew that we were changing, like Gail Lebovic, you know, it's been supplanted, like, I don't know, focal supplanted the precursor to that. But it set the tone for 5-day treatments, you know, 5-day radiation treatments. And you know, you can look back on your career, look back on my career, and the things that we've introduced. I can go into a sterile corridor of a OR, and there's about 10 products that I was, you know, involved with, and it's, you know, I'm proud of that. I'm proud of what you and I did together at Focal, and the rest of the team. It was a lot of fun.
Likewise, it was amazing. I mean, it is revolutionary when you stop and you look back. You know, none of it was planned. It's not like you make an outline and you say, okay, we're going to do this, 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 this. It doesn't work like that. It's like, you know, my first product was the breast binder, which was a very simple product, but it's still on the market today. I designed that when I was in medical school, and it was just to make it better, more comfortable, prevent hematoma and bruising, you know, very simple. You start with that clinical need, and then you build on, like Jeff said, the patient-centric experience. Keep the patient at the core and the center. You'll never go wrong, and do the right thing. The money will follow. I know salespeople look at me like I'm crazy when I say, oh, the money will follow. It's like, no, really, the money will follow if you're committed and dedicated and you make the right choices based on the patients. It's true.
And I think it was a godsend that I didn't become a doctor, you know, because I don't think I would have been as good a doctor, you know.
Well, I don't think you would have had as many experiences. That's for sure. You wouldn't have had as much fun, probably.
I definitely would not have had as much fun. Yeah. I'm having too much fun, to be honest. So.
Well, you know, it's funny. It might surprise those who are listening, but you know, occasionally we do have a client. So for those who are maybe unfamiliar with what I do, I write resumes for medical salespeople to help them get the roles that they desire. And occasionally we'll have someone who says, hey, you know what? I've been selling XYZ for 15 years and I want a new challenge. You know, maybe I'll try software or some other kind of sale. And I had two people last year in particular who took that route. And so we helped them get there, and they did, and they were happy. And about 9 months later for one and 11 months later for the other, they called me back. And I remember driving downtown to Spokane, and they were like, Claire, it's not that it's not a worthy sale or a worthy profession. I just didn't realize how tied I was personally to the patient's outcomes. Now, they were both in roles where, I mean, they were a far cry from actually, touching a patient or laying hands on a patient. But they, at the end of their rainbow, at the end of the sale, they knew that it was making a difference in somebody's mom's life, in somebody's father's life, in somebody's child's life. And it's almost as if they didn't know they had that why until they left it. So I really think that's kind of a neat part of this field, because I think a lot of people do go in, like you're saying, Dr. Gail, that they go in thinking, hey, you know what, I can make a lot of money here. I can have a nice flexible schedule. I can maybe live in Florida, like all these wonderful things. And then the purpose, if it's not already there in them, it sometimes tends to creep in, because you know that every single action you take, there's a patient on the other end of the line. And Jeff, this reminds me so much of that story that you told me early on, I think that when we were working together, about making one more call. And I find that when you have that passion, like Dr. Gail, it is not a secret that you're passionate about what you do and the products that you create. And Jeff, it is not a secret that you are not you're passionate about getting products that really make a difference to market. And so if you wouldn't mind, could you share that story about that one more call? Because I feel like when you have that passion, that tends to be the cadence that you operate under. One more call, one more person. What else can I do?
Yeah. Well, it's a story that takes place. I won't go into all the details about it. I'll start with the morning. It was a Nissen fundoplication, Gail. It was a long case, back in the early 90s. These were laparoscopic cases that were, tedious, difficult. And I was in practically every one of them, it seemed, in Virginia. But I was in Southwest Virginia, in like a rural town in a small hospital, and we were doing a fundoplication. And I think hour 5, no pun intended, we wrapped up, So I got to the locker room. It's about 2:30, and I'm changing out into my full blown suit. By the way, we wore 2-piece suits the whole. So I'm in there, and I'm thinking, well, I got an hour and a half drive home through the mountains. I'll go see my daughters at gymnastics. I had 2 gymnasts, Gail, and or my son play baseball or something. And I'm thinking. So I'm driving, I got an hour and a half drive, and I'm halfway, and there's a little Memorial Hospital on the way home. I'm like, and they're a competitive account, US Surgical, and so I'm like, as a boy, I worked these fields, and I used to do, work one more row. The field hand would tell me, work one more row. And I'm thinking to myself, make one more call. So I made one more call. And back then you didn't have rep tracks. There were no locks in the OR. I just went up there. And I had my sterile bag with me and some brochures, never thinking that I was going to get very far. Sliding glass window opens, and Susie sees me, and out of the corner, the circulating nurse who was bouncing in and out of room 3 sees me. She comes running out, and she says, Dr. Jones would like you to come into room 3. This is highly unusual, right? I'm just here making one more call, thinking I'm going through the motions. So I get in a bunny suit, right? I get in the room, and I've never seen a scene like this. It was like a trauma, it was blood everywhere. And so I learned from the doctor that it was a failed linear stapler line, and deep in the male pelvis. It was a low anterior resection, and they're moving towards colostomy. And so he asked me if I had anything, and I happened to have like a stapler with me. It had a malleable head, and we fired it. We completed the case, did the anastomosis, and all was well. I just got back in my car. Never got the business. Never got the business.
It's not about the money, Jeff.
It wasn't about it. It was about.
Right.
And I didn't even realize it till a long time later that sometimes things work mysteriously, and if I don't make that call, it's not about me. I'm just saying that we can make a difference. And I made one more call that day, and that guy will never know me, whoever was on the table. I'll never know him, but I know he got the best treatment that day. He got the anastomosis that he needed. And like I said, I just got back in my car and went home. It was like, and it was sometime later when I realized that the impact we have on patients and on physicians, and I'm fortunate to be here, and there's purpose in what we're doing.
Absolutely. Can't be understated. That's a great story.
Yeah.
One more call, one more row.
One more call. Yeah. Yeah. And at the end of every action, it's touching and helping a patient in some way, helping a provider be more confident in a case when stuff goes south. Like really being in it together, I think is so remarkable. One thing I would really like to see is more support of medical sales reps in hospitals. I've been hearing some real horror stories lately. I was just talking to somebody the other day who, it can be so restrictive that sometimes, in this case, I was talking to one of my friends who's a surgeon, and she was saying, I used to have more control over what was coming into my OR because I felt like I had more options because I was learning more often. And yes, of course, she said sometimes it was annoying. Like I didn't want her to do 5 dinners a week, but she felt like that sometimes the restrictions had become too great, and it's harmed the partnership that there was in the OR previously. And I know, Dr. Gail, I know are you still operating, or is that all in the past?
Not right now, but I keep fantasizing about getting back into the operating room. It's just that I'm so busy with, running the business, that it's difficult to do both at this time, but I'm still board certified and licensed and ready to go. So at any point, but I'm glad you brought that up. It's probably the conversation for another podcast, to be honest, because this dovetails into all of the changes that we've seen in medicine. And Jeff, I was just longing for those days that you were talking about, where you just drove up and were able to get into an operating room. I think we're living in a really restricted regulatory environment, and that penetrates all different aspects of the medical device field, including innovation. So I think it's worthy of a conversation because the environment has changed so much from the good old days that it's interesting. We need to think about the future and how that's going to impact. Is everything going to be AI and robotic surgery? No, I don't think so. But I do see some signs that are leading us down interesting paths. So it's worthy of a conversation.
Yeah. We'll have to do a round 3, Gail. So before we go, I deeply respect both of you, and from both of you, I've had great advice and heard great perspective on where you feel people can really thrive in a career, either in medicine or medicine and entrepreneurship, or even medical sales in a professional and executive sense. So I'd love to hear from each of you, if you were to give somebody who is either considering approaching or getting into this industry, or who's thinking, is it for me? Or maybe, how can I do it better, find more fulfillment here? What would you tell them, Dr. Gail?
Wow. Well, I think, trying it's kind of like taste testing. I think if you're thinking about getting into medical device sales, it's an awesome career, but it's not easy. It's not for the faint of heart. But it's incredibly rewarding. Like Jeff's story, it just says everything, right? Because that guy, even though you'll never meet him and you don't know who it was, you still tell that story. It's probably 30 years later. So it had that much impact on your life and his. You saved a life. It's a big deal. Yeah. So I think it's a very fulfilling career for a lifetime, and it can take many different turns, and it's very interesting and fun.
It's a lot of fun. Claire Claire, you sent me a lot of folks that are contemplating and they want to know whether or not they should pursue a medical device career. And I can tell when I speak to them, and I spoke with Marianthi Hostis this morning, and I got approval from her that I could tell this story.
Awesome.
When you sent her to me, I knew right away she had the passion and the drive, and this is something that she had to do. You know, if you don't have that, it's harder than ever to get in. And once you're in, it's no cakewalk. I mean, it's brutal. The restrictions, you know, I know we need standards. Reps need to have standards, but, you know, we're no longer considered part of the team. You know, we're relegated to the bowels of the hospital. We got little red hats on. We're sitting all alone. You know, they don't want us talking with doctors anymore. Well, I mean, that's a shame, you know, because a lot of times, Gail just mentioned one of her best friends is a rep, the best rep in the world. And, you know, she probably wants her in the room with her, you know, and sometimes they're not allowed. And that's getting harder and harder. Marianthi, she's great. She's I knew it. She's an opera singer. She's survived cancer twice and she wanted to get in. Yeah. And I was like, don't let anything stop you. Just run through it, run through the walls. And she did. And she's working for Hologic selling Biosorb.
All right.
Full circle.
Awesome.
There you have it.
Great.
There you have it.
You know, just one little tidbit on this. I think we should think about ways on this type of a platform where we can actually support the reps and create a community with physicians and reps and devices. And I think it would be really exciting and innovative to do that.
Yeah. See, there she is thinking. There she is thinking again.
Problem solving.
Problem solving. She sees a problem, she gets after it. She doesn't sleep much. We talked about that.
No, I don't.
That's why
Sleep is overrated.
Sleep is overrated. Yeah.
Oh yeah. Oh, that's definitely what my son thinks. He's up at 4 a.m. again today. But you know what?
She's up too. You know?
No, don't text me.
Tell him. But honestly, thank you guys so much for joining me today. And I love that idea. I think making realistic avenues, creating ways that physicians and medical sales professionals can start to collaborate in new ways is so important. I'll save my personal story for another day, but in short, if that weren't the case, I wouldn't be here having this podcast with you. So I am incredibly dedicated to forging that bridge where I feel like there have been almost too many restrictions and we need to come back together again. Because again, I mean, if we can't move forward together, we can't move forward. So I'm so incredibly grateful for both of you. You're both doing huge things in this industry. I admire you both deeply. And I'm so looking forward to conversation number 3. Let's do it.
Well, thank you, Claire. Thanks for having us.
No, thank you.
Of course.
Happy holidays, everybody.
Happy holidays.
Happy holidays.
And everybody who's here, thank you so much for joining us. Don't forget to follow Dr. Gail Lebovic and Geoff Beecher, of course. Make sure it's the first thing you do today on LinkedIn. And until next time, we wish you all the best. And thank you so much for joining us. Take care.
Bye, Gail.
Thanks.
Bye, Claire.
Bye, Geoff. Bye, Claire.
Bye.